Hello everybody, I am Dr. Meenakshi and this video is for the MRCOG students who are going to give the MRCOG examination. So in this video, I will be discussing about the FSRH guideline on the combined hormonal contraception. I will be linking this guideline in the description bar down below, and also please join in my Telegram channel, and I will be linking the channel's link in the description bar, and I'm also going to be pinning it in the first comment. So before we actually discuss about the combined hormonal contraception, I would want to quickly revise the UKMEC, that is the UK medical eligibility criteria for the combined hormonal contraception. So we have got 4 categories, that is UKMEC 1, 2, 3 and 4. So questions can be expected, like they would give you a condition for example, and you would be asked to tell whether it falls under UKMEC 1, 2, 3 or 4. So UKMEC 1 means there is no restriction for the usage of the method. 2 means the benefits are more as compared to that of the risks, so therefore you can choose the method. And then we've got the UKMEC 3, which means the risks of using the method are much higher as compared to that of benefits. So we go for this method only if other methods are not suitable to the patient. And then we have the UKMEC 4, which is a complete no-no, and that's an absolute contraindication. Therefore, that method is not at all suitable for the patient. So UKMEC 1, 2, 3 and 4. These are very important. So next, let's discuss about the forms of the combined hormonal contraception. We've got 3 forms. Either it is available in the form of pills, or in the form of a transdermal patch, or it is also available in the form of the vaginal drink. And all of them are found to be equally effective. So the mechanism of action. Mechanism of action primarily is by the inhibition of the ovulation. It acts on the axis and thereby inhibits the ovulation, which is a really important point. Although the progesterone component helps in the thickening of the cervical mucus, and also it interferes with the tubal motility and also with the endometrial thickness, but primarily the mechanism of action is by inhibiting the ovulation. And then what are the failure rates which are associated? This is also a very important question which can be expected. So the failure rate, if you're using the pills perfectly, or if you're using the method perfectly for the combined hormonal contraception, the failure rate is less than 1%. But we have another usage which is called as the typical use, which means whenever the pills are used incorrectly, or if at all the pills are missed, in such cases the failure rate is high. It can go even as high up to 9%. So these figures are also very important from exam point of view. And then certain drug interactions which are important in terms of combined hormonal contraception are, like for epilepsy, if you're using a drug called lamotrigine, there are some interactions which are expected. So therefore the seizure frequency is known to be increased, or there is also an increase in the lamotrigine toxicity. So therefore with lamotrigine usage, the combined hormonal contraceptive pills comes under UKMEC 3. So this is also an important point. The risks are much more as compared to that of the benefits. Therefore it falls under UKMEC 3. And what does the guideline recommend is that the estrogen component with less than 30 micrograms dosage and the progesterone should be either levonorgestrel or the norethistierone. Both of these is considered as the first choice of progesterone when it comes to combined pills, because the cardiovascular risk in terms of using these levonorgestrel and norethistierone is found to be lesser. So therefore the guideline recommends that we use the estrogen component of less than 30 microgram and progesterone as levonorgestrel or the norethistierone, which is another important point. And in case you're taking the emergency contraception, if you're taking the ulipristal acetate, and if you want to take the combined pills as an ongoing method of contraception, it is always advisable to wait for at least 5 days after you have taken the ulipristal acetate in order to start the combined hormonal contraception. I will be discussing about the emergency contraception as well in my upcoming videos, so therefore stay tuned. And the next important point is, whenever you're taking a pill and if you vomit within 3 hours, it is considered as a missed pill. Or if there is a severe diarrhea lasting for more than 24 hours, in such cases also it is considered as missed pill. Therefore we need to repeat the dose in order to maintain the efficacy. So that is one more important point. And there are some non-contraceptive benefits with respect to these contraceptive pills. It is used in treatment of heavy menstrual bleeding, dysmenorrhea, PCOS, acne, hirsutism, and also it is known to reduce the incidence of 3 different cancers, which I remember as CEO. C stands for colorectal cancer and not cervical. So please remember it is colorectal. And E stands for endometrial cancer and O stands for ovarian cancer. So all these three cancers incidence are known to be reduced. But cervical cancer risk is found to be slightly higher in case of usage of OC pills. And also there are certain risks which are associated with this. There are some evidence which states that there is an increased risk of venous thromboembolism, myocardial infarction as well as stroke in women who use contraceptive pills as compared to the women who do not use it. And the final topic of today's session is going to be the missed pills, which is an extremely important topic, especially for the MRCOG Part 2 students where the questions can be expected. Suppose we take these missed pills in terms of whether you're missing it in the first week or in the second week of your cycle or in the third week of cycle. Suppose you're missing one pill either in the first week, second week or third week, emergency contraception is not at all needed. Missed pill 1 means when you have missed a pill and it is less than 24 hours. Suppose you have forgotten to take in the yesterday's pill and you remember it today, that is called as a missed pill. So if you're missing just one pill in any part of the week, emergency contraception is not required. You take the regular pills at the usual time and the pack will be continued accordingly. So emergency contraception is not required. Supposingly you're missing between 2 to 7 pills in the first week. So having the integrity in the first week is extremely important because the FSH and LH would be released in the initial part of the cycle. So inhibiting that access is important. So in case we are missing it in the first week, then the chances of having the pregnancy is at least slightly higher. So therefore, if you're missing in the first week, take it up with the emergency contraception and the remaining pills would be taken up accordingly, which is given in the packet. Suppose you're missing it in the second or in the third week, then definitely an emergency contraception is not required if you have taken it perfectly during the first week. And then take the pills accordingly, continue the pack, and then in case you're missing it in the third week, then we have to omit the hormone-free interval, which is the last part of the cycle. And in case you're missing more than 7 pills, that is continuously if you've missed more than 1 week, then definitely we have to do a high sensitive pregnancy test and restart the pack as a fresh pack, and also we have to take another quick start of hormonal contraception as in to get the additional contraceptive cover. And this was just a very clear and an overall idea about the combined hormonal contraception. I hope you all found this useful, and please do join the Telegram channel for more updates. I will see you all in another one. Bye.